Okay, this video is going to be over Chapter 5, which is CPR. And let's just talk a little bit about the reason we would use CPR. We have heart attacks. And so a person that's having a heart attack, there is a lack or no oxygen. I'll just put O2 for that, getting to the muscle tissue, and so the muscle tissue starts to die. So that would be a heart attack, and then that can lead to cardiac arrest. So we have cardiac arrest, and that's where the damage is so severe that the heart stops beating. Severe, and the heart stops, so the heart stops beating. And if the heart stops beating, then we're not going to get enough oxygen out to the tissue, and therefore the tissues will die. So let's talk a little bit about the chain of survival, the cardiac chain of survival. So in this chain of survival, it's important, let's just say number one here is that we recognize what's going on and we take action. And by taking action, since we recognize what's going on, our first step, since it's a cardiac emergency, once we determine that or once we think that's what's happening, we want to call 911. So we recognize and call 911. So that's our first action. Then we want to give care. So remember we did the check call care. That's how that plays into this. So CPR would be the appropriate care if there's no AED available. So that's going to give us more time. And time is really what CPR is going to give us. It's limited because, again, like I said in the last video, we're only pumping about 1/3 of the normal blood supply. And so therefore, I can't tell you the exact figure of how much oxygen is getting out to the tissue, but at least we know it's 1/3 of what would normally get there. At most, it's 1/3 because we're only getting 1/3 of the normal blood supply out to the tissue. And with CPR, let's go ahead and finish the cardiac chain of survival, and then we'll talk about CPR a little bit. If there is an AED available, defibrillation. So that's what an AED is, automatic or automated external defibrillator. So that's going to give an electrical shock to the heart and try to reset. So if it's in some sort of arrhythmia, the AED can shock it and get it back to normal. We'll talk about that later in the next chapter about AEDs and how they work and when they'll work and when they won't. So defibrillation. This actually, I feel, your book defines it this way. So it has CPR first, and I understand what they're talking about. You're doing CPR until the AED is ready to use. But if an AED was ready to go, you would use it. It has priority over CPR because it's more likely to work. And so it has a better chance of working and giving that person a chance to live because it can reshock the heart and have it start pumping on its own. It won't restart a dead heart, but we'll talk about that in later chapters. So if the heart's in asystole, it won't restart it. And so the next step is advanced care. That's the whole reason we called up here, is to get EMS on its way. So we called, and then we began giving care, buying this person more time, and maybe even used a defibrillator, and hopefully EMS arrived as soon as they could. Depends on how far they are away and how soon they got the call. And then 5 would be post-arrest care. So if somebody has a heart attack, they're not just going to walk back out the door, especially if there's been damage to the cardiac tissue. It doesn't repair itself. They're probably going to spend some time in the hospital. So cardiac tissue is different than skeletal tissue. Skeletal tissue can repair itself, but once cardiac tissue has been damaged, it will not repair itself. That's the reason people have to have heart transplants sometimes. They have such a severe heart attack and a lack of oxygen to that tissue. It goes on for so long that the tissue just dies and never comes back. And so they either have to have a heart transplant or a pacemaker or something like that, artificial heart to replace that. Now let's go into CPR itself. So let's just deal with the specifics of CPR. It's supposed to be a P there. So with CPR, we've got the first thing we want to do. Let's just go back to the check call care. So we check the scene, we check the victim, and during the check, we're checking for signs of life. So we check for signs of life no more than 10 seconds, because again, time is of the essence. So we check for 10 seconds. After the 10 seconds, we determine what's wrong. So if it's an adult and they're unresponsive, we're going to begin CPR. So the first thing we do are 30 compressions for about, let me just put compressions there so you'll know what I'm talking about, for about 18 seconds. So it's about a half second for each one. And after we do the 30 compressions, we'll give 2 rescue breaths. And then we continue this. So we do 30 compressions. After that, we do a head tilt, just to get more specific here. Chin lift, just to make sure the airway's open. Then we give the 2 rescue breaths, and we keep repeating that. 30 compressions, head tilt, chin lift, 2 rescue breaths. And we keep doing that until we're too exhausted to continue. EMS arrives. Scene becomes unsafe, or another trained responder takes over. So now if this is a child and we're alone, there's no one else to call, we do 5 cycles first, because typically with a child it's some sort of breathing emergency that has led to some sort of cardiac emergency, whereas with an adult it tends to be a cardiac emergency. So that's the reason we call first. Anytime it's a cardiac emergency, we call first. Here with a child, when we start doing those chest compressions, if it's a breathing emergency, we might pop the object out. So we're essentially doing unconscious choking skills there once we start doing the chest compressions. So even before we give the rescue breaths, if we start doing our 5 cycles, we might pop the object out and they could potentially start breathing again. So maybe their heart hasn't stopped yet. So that's the reason we're doing the 5 cycles first with a child or an infant. Tends to be a breathing emergency that led to the problem. So that's CPR. Let's go into some details that your book doesn't really talk about, and don't dwell on these too much. I know why the book left them out. They're trying to simplify these layperson skills so much that you don't have too much to think about. They just say hard and fast. They don't tell you the depth of the compression and all that, and that's good because you just want to be able to react. But I just want this is something your book doesn't talk about, something that is alright to know. Don't dwell on it too much. For an adult, you're going to do compressions of about 2 inches in depth. For a child, depending on how large they are, 1.5 to 1 inch. And for an infant, 1 to 1/2 inch deep on the compressions. If this is an older person, you start doing compressions, you may hear some popping and some cracking. You may break a rib. It's always, anytime you do a skill like CPR that's pretty invasive, it's always a cost benefits. They're going to die if you don't do CPR, most likely, unless care just gets there. So the cost of not doing the skill, the benefits outweigh the cost, essentially, is what I'm getting at. So yes, you may get some popping, you may get some cracking, you may hurt the person, you may do some internal injuries. But if you do not do that, tissue is going to die. And so really that 4 to 6 minute window is extremely important. So 4 to 6 minutes, because every minute care's delay reduces their chance of survival by 10%. So that 4 to 6 minute, right around this area here is where they're going. If they don't get some sort of care, they're going to start suffering brain damage and tissue. I'll just put tissue damage because it encompasses all of it. So they're going to have some sort of tissue damage occur around 10 minutes, and it's not our place to make the call. You just keep giving care. It doesn't matter if it's 99 minutes. You keep giving care no matter what, unless you're just too exhausted to continue. Around the 10-minute mark, their chances aren't very good. But if I can find the video, I'll upload it, where they did CPR on a guy up in North Dakota, South Dakota, somewhere like that, way up north, where care was delayed for a long period of time. I think it's like 98 minutes, 92 minutes, something like that, where people just kept taking turns. They had a line out the door of people taking over and doing CPR, and the guy ended up living. So it's not our place to make the call. We're not doctors, so we just give care until somebody takes over for us, hopefully. So that's CPR in a nutshell. And in the next video, we'll talk about an AED. So I hope this video was useful. I hope it explained the purpose of CPR. And actually, one more thing before I stop. Let's say this is somebody's chest here, and let's say here's their heart, right? So when we do, oops, let me make that smaller here. Let me just undo that. Let's say this is somebody's heart, right? Setting in their chest, and we go to do compressions. What we're doing is we're smushing that heart, so that we're smushing all the blood out of it, so that it pumps out the arteries and gets out to the tissue. So that's essentially what we're doing. I just want to describe that to you. So when we do these compressions, we're smushing the heart. We're manually pumping the heart. It's not as effective as if the heart was pumping on its own, but it's better than nothing, and it can buy these people some time. So I just want to explain that. So I hope this was useful to you. I will see you in the next video, which I believe is AED.